online radio platform, which runs internally for our crewmates, basically.
Okay.
Yeah. So every month we'll make sure that there is a doctor from each special concern, like monthly, like cardiologist, dentist, like some things. So this time we want you to be host the show, ma'am, for this month, because also we are falling in summer, right? So that's why.
Mm-hmm.
So with your permission, I would like to start the show, ma'am. Is it fine?
Yeah, sure.
So we have 4 centers, ma'am. So there are listeners. It's an radio. So some people may join on live, and basically people will listen you on the radio. We have a speaker setups, everything followed in all the centers. So they'll be listening to you. If there is any question, they'll be posting me in the chat box. I'll be asking that question to you also on the line. Yeah, ma'am. So a very good afternoon to everyone. A warm welcome to all our wonderful listeners joining us today on DC Live. We are truly happy to have you with us for this special session. Today's show is something very meaningful and useful for all of us, especially taking better care of our health in our busy lives. We are honored to have with us Dr. Bhuvaneshwari Ramalingam, a highly experienced general physician and internal medicine specialist from Apollo Specialty Hospital, OMR. With a strong medical experts and a passion of preventive healthcare, she has been guiding many individuals towards a healthier lifestyle. Doctor, thank you so much taking your valuable time and joining us today. We are really excited to learn from you and hear your insight. To all our listeners, stay tuned. This session is going to be very informative, practical, and definitely helpful for your day-to-day healthy. Let's get started. Happy to have you on live, ma'am.
Yeah, thank you. I didn't get your name.
I'm Srilekha, ma'am.
Okay, thank you, Mrs. Srilekha. I'm trying to share my PPT. Just give me some time, okay?
Please. So, what are the languages you are comfortable, ma'am? Like,
yeah, English, of course. Tamil, yes, Tamil.
Okay, because we have center in Karnataka also. We have Kannada people and Hindi. Few people also understand.
Yeah, I can converse very well. Yeah.
Sure, ma'am. Yeah. If there is any live questions comes to you, just want to know like what other languages you are comfortable with.
Yeah.
Thank you.
Just give me some time, okay?
You want any help, ma'am, in that?
Yeah, I am trying to get this PPT.
Okay.
Environmental scenario we are in. So we're all, already heat is taking a toll, and we haven't yet gone into that peak summer. So I really appreciate for choosing this topic, and so that more insights can be shared to the viewers. First, so moving on to the topic. So as we are, we stay outside in sunlight for a long time, and especially kids, and or you go on outing because it's vacation time, you want to spend time outside. So in that excitement, when we try to stay outside, and a lot of changes which our skin goes through. So of course, first is the sun tanning. So there's a lot of hyperpigmentation that happens, and the best way, of course, you all know it's better to use a sunscreen before you go out. And also, once you come back from outside, make sure you take cool showers, apply some aloe vera containing moisturizer so that you soothe your skin. But sometimes what happens, this can go to the extent of sunburn. So when there's a lot of heat which your skin takes in, so it can lead to burns in your skin, something like burns. So the damage could it's not like the damage is restricted to the superficial layers of the skin, but it can also go to the deeper layers of skin. So in those instances, apart from those the tanning you also feel your skin is painful, it's burning, it is red, and it may even be hot to touch. So that's when we call, and it happens in the exposed areas. So especially, it could be over your face, your arms, your neck, your back. And so in those instances, what you do, of course, you have to cool your affected area. So what you do is you make sure you take cold showers and also use cold compresses. So cold compresses are these are when you wet the cloth, you make the cloth damp with ice cold water and apply it over the affected areas, and you can leave it there for like few minutes and then reapply. So when you do this, you are going to soothe your skin, you are going to heal your skin, and followed by that you can apply the moisturizer, especially aloe vera containing, so that locks in the moisture. And next time when you step out, just make sure you apply a sunscreen. So so this was about sunburns. So the next common skin conditions which happen with sun, when you are exposed to sun, or when you're sweating a lot, and this is more common in children and adults, especially who are sweating, who stay outside and who sweats a lot, especially those like who exercises outside, or street vendors, etc. So this condition is known as heat rashes. So these are these small red bumps or blisters which can occur, often seen around the neck, or it can be around the thighs or upper back, where these occur because your sweat glands, they're blocked, and a lot of sweat is trapped beneath the skin, and that can lead to these heat rashes. So the thing is, these rashes are itchy and they are very uncomfortable. So you can see your kids scratching, a lot. That can itself lead to secondary infection, and it can form pus and superficial infections also. So again, what to do when you notice these kind of rashes, heat rashes? So same thing, just make sure you take cool showers, or sometimes, of course, you can apply the cold compresses. Then, of course, you can also use calamine lotion and try to soothe them. Sometimes if the itchiness is too much, then even anti-allergic medications, oral medications can be used to reduce the itch. So these are the common, skin conditions which one can come across when you are outside and you're sweating a lot. So moving on to conditions which occurs because of too much of sweating. So often, you all know, you stay outside, you're not even doing any strenuous activity, but you may still feel dehydrated. So because you're losing water through sweat, because sweat has 98% water, and the remaining is salt and proteins, etc. So you might feel very thirsty and tired. Once again, sorry for interruption. I'm just trying to, someone has come to help me to share the PPT. Okay. Yeah. So our dehydration, as I was talking about, is something quite common during these days. So obviously, one feels thirsty, tired, and feels lightheaded, and that is giddy. Might feel giddy. One more thing is that you can watch for is your urine may be dark, may appear dark colored. So in those instances, make sure you hydrate yourself with lots of just plain water would do. And of course, if possible, you can go for a coconut water or the kanji. All those will also be helpful. ORS, yes, that will also be if available. You can also have those to replenish not only fluids but also the salts which are lost. Okay, so when you stay outdoors and you're sweating a lot, sometimes it may go beyond being you might have heat exhaustion. So what is heat exhaustion is you have your temperature, body temperature going up, which may go up to 100 degrees Celsius, with some more symptoms like you can experience. So that would be like, you're profusely sweating, you feel dizzy, of course, there can be headaches, you feel nauseous. Sometimes you may also have vomiting. You can also have muscle cramps, especially in your calf region, and your heart is racing fast, and you feel more, your breathing is more faster. So in those instances, as soon as you experience this or you see someone like this, make sure you isolate them, take them to a cooler place, or it could be under a shade or inside a building, and try giving them rehydrating them, so giving them fluids, and so that aim is to cool the body as much as possible. So also if there is a water facility available, so you can sprinkle some water and make them sit under fan or in air condition, so that will let the body cool down. And if these symptoms do not improve within 30 minutes, in those instances, it can progress to becoming something known as heat stroke. The heat stroke is a medical emergency where your temperature further goes up. It can reach up to even 104 degrees Fahrenheit. You are no longer sweating. Your body is not trying to thermoregulate. The temperature regulating center has stopped working because of the excessive heat outside. And you have, because sweating is a mode of cooling down your temperature. Your body has this natural phenomenon, but when your body's thermostat is, because it's no longer working, so it doesn't sweat. Your body doesn't sweat, so your temperature, the core temperature, further goes up. So in those instances, when the temperature goes up, your cells, especially proteins inside the cells, cannot function properly or appropriately when the temperature goes up, and they start failing. So what happens, the initial symptoms or the symptoms by which you can identify heat stroke is your body, when you feel hot or your temperature is more, then of course you're no longer sweating, and sometimes you might also be confused, you might be agitated, and in those instances sometimes you may also lose your consciousness. So if you come across a person who's a bit feel disoriented, and make sure you give them again, go to a cooler place, help him or her cool his body temperature, and try to give him fluids. If he's so much confused or nauseous, unable to give him him or her fluids, so make sure you transfer that person immediately to the hospital, because in the hospital, the person's body temperature can be cooled down, can be brought down by giving their mechanisms to reduce the temperature, and also IV fluids are given, intravenous fluids, which is going to hydrate that person. And on top of that, the other blood tests will be performed to make sure there is no multi-organ failure, because as I said, the high temperature can cause a lot of damage to your organs. So these blood tests will be performed to make sure your organs, there is no renal failure especially, and accordingly managed. So heat stroke is something one has to be aware of, because when temperature is more, we think more in terms of infection. We think you are having fever. It's not so. So in summer, during summers, be careful. Whenever your temperature is high, also think in terms of heat exhaustion. So because taking paracetamol in those instances is not going to bring down the temperature. It's going to just worsen the condition. So I would definitely insist you all to be aware of this heat stroke, and so that you can take precautions, or you can help your counterparts or your colleagues or your friends or family members recover from this heat stroke at the earliest. Also, the heat stroke is quite common in children, because when they are outside playing, in the excitement, they don't hydrate themselves. They sweat a lot, but they don't equally replenish the lost fluids. So they are more prone for heat stroke, and they don't take time, or they don't take rest in between when they are like playing. So they continue to play. So the kids or the children are at high risk for heat stroke. Similarly, elderly people are also at high risk. Even though they remain at home, they fail to drink water because their thirst level, they're not able to appreciate the thirst majority of the times, and they're also more prone for these heat-related ailments. Additionally, if anyone is on medications for especially on diuretics, it could be because of the renal failure or heart failure, or they're on beta blockers for their blood pressure, or if they're on antipsychotic medications for the anxiety or depression. If an individual is on these medications, so these medications reduce the body's adaptation to the high heat around people. So what happens? Because of the less of these thermoregulatory functions happening inside the body, and because of which these individuals are at high risk for heat stroke. So moving on next to the conditions that can occur because of intake of contaminated food and water. So what happens is, as you all know, summer is a time where food can easily get contaminated. They can get spoiled. So and also water contamination can happen, especially when there's a lot of demand for water and the supply is not met adequately. And when you are traveling outside and you are not bothered about the quality, it's not about bothered, it's just that you're thirsty, you want to have water, and you are not that time much aware of the kind of water you drink, especially the fruit juices, the water they mix in fruit juices, etc. If contaminated, could result in a lot of GI manifestations. So one of the commonest, what we call is food poisoning, which happens because of such conditions. So immediately, as soon as you consume these kind of stale food or the contaminated food, you have abdomen pain, vomiting, diarrhea, and generally it could be very mild. So you usually recover within a day or two with proper hydration. And but sometimes what can happen is, if your food was affected by the bacteria like the cholera causing bacteria, in those instances what will happen is you can have profuse watery stools, which is known as rice water stools, and which will result in rapid dehydration along with vomiting. So in those instances you will have repeatedly you pass stools, watery stools, and you are like you are so tired, and you will require hospitalization there, because you need you need IV fluids to replenish your fluid loss, and along with medications accordingly to treat the cholera. And of course, cholera is something which can be picked up by stool test. Yet another bacterial infection which is common in summer because of this contaminated water intake is the typhoid. So what happens is, again, in typhoid, this presents, the presentation will be slightly different here. You have a fever, which is prolonged days of fever. And the fever can extend for 3 days or more. And fever is something like, it is on and off. And the fever can be high-grade fever. So associated with headache. And you, of course, feel weak. You also have digestive problems, like you can have diarrhea, again, which may not be consistent. Diarrhea may be like on and off. So in those instances, right, then when we do blood tests, we can find out whether you have this particular bacteria which causes typhoid. And once it has been identified, you'll be given antibiotics, and of course you need oral rehydration solution or IV fluids accordingly to treat the condition. Okay, so those are the few conditions which occur because of contaminated water and fluid. Then you have like dysentery or traveler's diarrhea, again, which is caused because of E. coli infection. Again, often consuming food from outside. So you have to be careful, especially when you are, dining out or you are consuming any outside food. So moving on to other kind of illnesses, like because of the respiratory spread. So certain infection occur because they spread through respiratory secretions. You cough, you sneeze, even when you're talking. So that can also result in spread of these infections. So mumps is such condition. It's a viral infection, which is quite common during summertime. And what it actually does is this goes and causes inflammation of your salivary gland, the glands which help in producing saliva. And so there is how can you find whether you have mumps or not? The jaw or cheek, near the jaw or cheek, you have swelling. You'll have, of course, fever, and also you can have muscle pain. So this usually occurs. This can be one-sided, but sometimes it can be bilateral as well. So it doesn't require any nothing to diagnose. So once clinically it is well evident. So once you've been diagnosed with mumps, you'll have to be isolated because it's highly contagious. So if you have the person whom you are moving around with, definitely is prone to get this infection. So you have to isolate yourself, rest, and there's no particular medications for this. It is self-limiting. So within a week's time, you will be all right and back to work. And of course, during those conditions, during the illness, you will have to be on fluids or some soft diet because the movement of your jaw will be restricted because of the inflammation. Next similar condition is something known as chickenpox. Majority of us would have come across this chickenpox in childhood days. So this is more common during summer. It's not like once you've got this infection, you need not get in during your adulthood. You still can. It all depends upon the immunity as well. So obviously, how do you know whether you have got chickenpox or not? So the classic presentation of it in form of small, itchy, red spots or blisters, which initially occurs over your face or neck, and then spreads to trunk and your arms. So these skin lesions are very itchy. If you touch, you get infected. So usually till these skin lesions they heal, you are highly infectious. Of course, these you have skin lesions associated. They can be fever and upper respiratory tract infection symptoms can also be there. So, so as I initially mentioned, you have to isolate yourself till all the blisters, the skin lesions, they heal and they're all dried up. So during the illness, you will be given antiviral medications and of course the calamine lotion to help reduce the itch and discomfort. It takes at least 10 to 14 days for these blisters to settle down completely and come back to work. Okay. Moving on to the next one, which is also a respiratory, which is spread through respiratory tract and is highly contagious, called as measles. Measles is quite, though common in children, but even adults do get. So if you have fever, any upper respiratory tract infection like symptoms like fever, sore throat, cough, runny nose, along with if you have conjunctivitis like feature, like your eyes are red and there's secretions. Apart from that, you also will have rashes. These rashes initially occur around the hairline and then they spread down to they spread all over the face, then the neck, the trunk, then the entire body till your toes. So the how these rashes, how they're different from the ones which you get in chicken poxes. These are non-itchy and they are not fluid filled. Whereas in chicken pox vaccines, they're all in chicken pox rashes, they're all fluid filled. So that's the difference what we see between these two diseases. So so these rashes, once they appear, they spread down to the feet, and because you are highly infectious, so even after the rashes disappear, so at least 4 days after that, also you have to stay at home 4 days, at least 4 days after, to protect your family members or your colleagues. So again, treatment is, there's no particular treatment for this. It's just symptomatic treatment, and usually one will recover easily without any complications. So those were some of the commonest infection which spreads through, which is because of the air droplets. So next would be moving on to the other infections, like you have the mosquitoes, which are quite common in summer. It's not just only during rainy season you come across the those conditions, but even in summer, because of the mosquito menace, you may come across dengue, chikungunya, malaria. So you have to be careful from these diseases also. So like dengue, if it presents, mostly you have fever with severe body pain and muscle pain, and you might have rashes can occur, but not quite common. But if the fever doesn't settle down, then of course doing a blood test will help us know whether you're suffering from dengue. And of course, the accordingly the platelet count, which might drop, has to be followed up and managed with IV fluid, with oral or IV fluids. Of course, chikungunya, and also one can have high fever. But what is the peculiarity of it is the arthritis which it presents with. So you have more of joint pains, joint swelling, and the arthritis-like condition, which even continues after you are recovered from that fever. Again, malaria, the fever, one has fever, which is like which has a particular pattern. Like once it the fever repeats in evening, and it is like you can have headache, And the fever is like, you shiver a lot, and your shivering subsides with sweating. So all these give the clue that it might be malaria. You might be having malaria, and subsequently blood test will also help us know, and where you can be treated with particular anti-malarial medications. So these were the common conditions one can expect. So moving on to prevention aspect. So how to stay safe in this hot summer? First and foremost is make sure you hydrate yourself. So keep yourself well hydrated. Drink at least 8 to 10 glasses of water every day. And you can also use, apart from the plain water, you can also give, you can prefer coconut water, lemon water with some salt, kanji, then of course fresh juices where you don't mix sugar. Buttermilk is a good way to keep your electrolytes and fluids balanced. So what you have to remember additionally is like, regardless of what activity level, whether you are inside air-conditioned atmosphere or you are like, outdoors, make sure you drink water. It's not that when you're thirsty, you have to drink water. Just make sure, irrespective of that, you consume at least like 2 to 3 liters of water every day. You can also have oral rehydration solution or ORS. Also, you can use that to hydrate yourself. But sports drinks, I would say avoid all those drinks, sports drinks. If you're really in an outdoor activity, you're outside in an outdoor activity, then you can consume those. Otherwise, if you're not active much, then you can manage yourself with all these natural drinks which I've already mentioned. Or try to avoid caffeinated drink, of course alcohol. All these are going to further cause dehydration. So make sure you avoid all these. Next comes your eating habits. You have to change your habits, the way you eat. So summer is a time where you make sure you give preference to home cooked foods, avoid outdoor foods, and go for something which is light. And eat something which is, give preference to ones which are like, fresh veggies and fruits. Make sure you wash those vegetables and fruits with water and soda bicarbs appropriately, and avoid oily, spicy foods. And if you're storing foods, store them correctly, because power cuts can definitely, even though if it's refrigerated, if you have long hours of power cuts, so it's going to spoil your food items. So be aware of those and plan accordingly. If anything left over, of course, once you refrigerate and take it out, keep it aside for 15 minutes outside and then reheat them properly. And make sure you consume more of water-containing foods like, vegetables like cucumber, watermelon, muskmelon, etc. So which will definitely help to keep your temperature, hydrate yourself, and keep your temperature also under control. Next will be give importance to the clothing. Prefer light colored, loose clothing. Make sure you cover yourself completely with loose fitting clothing, so that you avoid yourself sunburn or suntans. And of course you all must be aware, like dark colored clothes absorb more heat and may increase your body temperature. So make sure you go for light colored clothes. Avoid tight fitting clothes and clothes like, prefer cotton clothes, as they will absorb sweat and not allow sweat to be there on your skin for a long time, because that will result in all these heat rashes. So make sure you dress up accordingly to protect yourself from heat. skin conditions due to the heat. Next would be moving on to the summer skincare. So obviously this is the time where you invest more on your sunscreen. Apply sunscreen generously with SPF 30 or more, and make sure you apply it 15 to 30 minutes before you step out of your house. Of course, once in every 4 hours, if you can, it is good if you can reapply it. Or if you've been sweating a lot outside and sweating a lot, make sure you reapply it once in 2 hours. That was about sunscreen. And to protect yourself in general, carry an umbrella or a hat so that you can also protect yourself from migraine headache, which gets triggered because of heat or the sunlight exposure. So once you come back from outside, make sure you moisturize yourself with aloe vera containing moisturizer so that it soothes your skin and protect you from all those heat rashes. If possible, take a cool shower, and especially in the evening once you come back from work, make sure you have showers. You shower yourself. Of course, word about mosquito prevention from mosquito bite. Use repellents or mosquito nets to prevent yourself from the bite. So other general precautions would be because of the viral outbreak, which is quite common in summer. Make sure you avoid overcrowded places, or possible wear a mask to protect yourself, and especially kids or elderly people. And avoid outdoor activity from 11 a.m. to 4 p.m. If at all you want your kids to play, let them play, but not during this 11 a.m. to 4 p.m. outside. Let them spend let them spend more time indoors during this particularly 11 a.m. to 4 p.m. A word about the air conditions and coolers, because after a long period of the air conditioned coolers which are like not used, once you are operating it during summers, which are at which we cannot stay without these air conditioned. So make sure you get them serviced properly, because otherwise they can circulate dust and allergens and trigger all these common respiratory infections and allergies. So you might feel that when you're in the air condition, you're sleeping in air conditioned room. In the morning when you get up, you have sneezing, runny nose, and all those. It could be because the air condition is not cleaned or serviced properly. So make sure that is maintained appropriately, and of course practice good personal hygiene, such as washing your hands frequently, especially after you come from office outside, or before eating. So all these precautions, if you carry on these precautions, definitely you can stay safe and enjoy the summer happily and have a good vacation with your family. Thank you from my side. So if you have any questions, please, I'm open to those questions.
There is one question from the listener's side. So when we talk about sunstroke, right? So there is a listener who have shared me that. I mean, during when they go in the hot sun, right? They feel like gritty, or they feel there is a wrinkle in the vision side. But when they have gone to the doctor, they've undergone with all the scan and everything, but still they couldn't find any of the reason. Only when he's going in the hot sun, right? He's finding gritty or something. What could be the reason, ma'am? Yeah, that's the message. That's a question from the listener's side.
Okay, so that happens throughout the year, or is it just during the summertime? Is it like only last few days?
When he's exposed to the sun, he come across that problem, like only when he's exposed to the sun. Otherwise, he's a very active person, like.
Okay.
Yeah.
See, again, there is nothing like, I mean, this is quite rare what he says, like when he's exposed, when he goes outside, immediately he feels giddy. Though there is no particular reason why a person should feel like that. But I would say if everything has come out, I mean, negative, all the test results are negative. So definitely, and I would say make sure he hydrates himself before he goes out.
Okay. Hydration.
Yeah, that is very important.
Okay. Because the person says like they have undergone with all the MRI scan, blood report, everything, eye testing also, because sometimes even the vision, it may also be a problem. Everything is perfect. So, but still he goes exposed to the sun, he feels like that, like.
Yeah. And what about headache? Does he also have headache? He has a symptom of headache along with giddiness. That
no, yeah, for the minutes he come across like 1 or 2 minutes he feel like giddy and he just get under the shade and after sometimes it's back to his normal thing, like.
Okay. I wouldn't say this is something. Hello.
Yes, ma'am. Yes.
Yeah. Okay. So I wouldn't say this is not as such related to heat or heat exposure. Just that he's too sensitive to the heat. That's what I would put it as. Otherwise, I don't feel like he has to be really worrying about this. Not too much bothered because the rest is all come out normal.
Okay. Good, ma'am. So this summer we want to be very hydrated, right? We want to drink more water and all.
Yes. Yes.
So, ma'am, I mean, people will say like, no, instead of taking, I mean, hydrate. Is that like taking a raw fruit will be better, or converting a fruit into a juice would be great? What is your suggestion, like?
I would say if you want an instant energy, like if you want like you're low and you instantly want energy, grab some fruits, put them in the mixie and drink it as a juice with not much of sugar. Again, you're going to add sugar to it and it's going to further make you feel low because your sugars are going to go up and then suddenly it will go down. So without sugars, if at all. Okay. Not much of sugar, if at all. Okay, but otherwise, I would say go for a normal, as such, and give preference to the water-containing fruits, right? So that will definitely be hydrating and also filling. It also has fiber too, so it will also help in that.
So we are 1,500 in our organization, and there is one general question as a doctor. Most of our basic crew spends long hour at our desk. Okay, so we have like mixture shift, like day shift, night shift, and all. For the internal medicine perspective, what is a silent health sign we should be paying attention to before they turn into a chronic issues like? Because this
okay, it's a general question. Okay, yeah.
Question.
Okay. So something which is silent but it can progress into a chronic illness. So one, I would say. Sedentary lifestyle, lack of activity. Definitely. If you're not moving much, you're more into sitting and not exercising, giving time for yourself over a period of time. Definitely, it will lead to all sorts of chronic illness, be it diabetes, be it hypertension, be it obesity related other complications. So again, so definitely that is one thing. One parameter we have to be conscious about. Then of course stress eating is something you have to watch for. And I know once you go back home, irrespective of the time, you just eat whatever is available. The quantity also, you're not much aware of the quantity, and that is the culprit. The other days, maybe other times like morning or afternoon, you're still, you're watching like you're watchful at what you're eating, but then not in the evening or after your day's work.
Yeah. Okay.
Yes. And yeah. And night duties, people definitely snacking something about.
Yeah, agree, ma'am.
Yeah.
So, ma'am, with weather changes often causing like nowadays illness is common. It's become a common because I mean in olden days we used to feel like only in the rainy days, winter season, we caught with of cold, cough and all. But now we can see that whether it is in cause of it, though it is a summer or a winter, people get caught of cold, cough, and everything. So to prevent all these things, what is your top 3 tips for building a top immunity power, ma'am? So follow these 3 tips to boost your immunity power. What could be that?
Okay. I would say, building your immunity, yes, you can, but rather more important would be, why don't you prevent yourself? Okay. So I feel, okay, when you're going outside, just make sure you wear your mask, and that is one thing, because of a lot of dust outside. And second, at home, make sure you keep your house neat and clean. I'm not saying nobody is doing that, but especially around your cot, or as I mentioned about the air condition, we don't give much, we don't notice what is going on around. So that is a hub for all the dust, and so especially because you're in that room for a long time at night, and you are prone for these allergies and towards these dust and dust particles. So I would say, please make sure especially the bedroom, where you make sure you keep each and every single item or neat and clean. And third, of course, give importance more to have more of antioxidants. Like, of course, antioxidants, it means more of fruits, variety of fruits. It means not just, eating like banana, apple, no. Go for other as well. I mean, pomegranates, then of course blueberries and all those, so these are all good sources of antioxidants. So go for variety of fruits. Definitely they'll help in improving your immunity.
Yeah, thanks, ma'am. Last but final question. Ma'am, now everybody are scrolling the mobile, right? Every day, whatever you see there is 7 juices, 7 days, 7 foods, 7 days, 7 foods, all these things. But there are also people who are talking about detoxing, like every day you take. But what is your suggestion? Is that good to take all the 7 days? I mean, detoxing, like one day they go with amla, then another day they go with pumpkin, white pumpkin, or something like that. So, and one day with the ginger water, or something like that, detoxing juices, varieties. So what is your perspective on that, ma'am?
Okay, week you have to detox yourself. Maybe monthly, take a week, you detox it and then leave it. You can't, it's not practically possible. Also, every day you keep on drinking something or the other, not necessary. So you can, but restrict it to a week in a month, so that will definitely be helpful.
Oh.
And of course, the other days you're going to be careful about what you eat as well. If you're going to do that, that is sufficient. It's not like you really have to, think about this detox each day,
Yeah, got it, ma'am. So that's a question from our side, ma'am. So there is also a big thanks from the center. People are listening to you in one speaker and one audio. They're saying that they had little here and there some simple doubt how to, I mean, we have youngsters from the 18 years plus to the all age different categories. So they said like, yes, little bit no, though they know the general things. When people personally comes in person and they tell us and they host a show like this live, it's very helpful for them, especially in the summer days, ma'am. And thank you. And you were very patient. The way you explained it, it was like talking to us on live. Though we felt it is like in radio, it is like you are talking to me. And that's what they also felt. Thanks, ma'am, for your wonderful time. Thank you so much.
Thanks a lot. Thanks for giving me this opportunity. Thank you.
Thank you. Thank you.
Stay safe.
Yeah, ma'am. Thank you.
Yeah.
So thank you, listeners. It was great. Like everybody joined from all the center and you spend enough time with us on this today's doctor show. Stay tuned to DC Live for more interesting show like this. You're listening to DC Live. We care, we share, and we are on air.